should be thought about and envisaged when we're talking about smart cities and rehabilitation. So what I would do is I would actually preempt, predict and prevent rather than treat, care and support. So I would like to shift the entire spectrum of care from treatment to preemption. And that is quintessential, so essential for being smart. Because once you fall ill and you know you're going to fall ill, it's certainly not being smart. And having said that, some of the lifestyle changes, for example, many of us use Fitbits when we walk or pedometers when we walk. But how many of us actually go back and try and understand? The system is not enabled to give you a feedback saying, hey, you have not completed your required 1,000 steps. You have not done this. It does not flag off. It does not give an alarm. It does not go back and tell your doctor he has not walked. So what really happens is the entire system is not complete. So having said that, there's a complete requirement for where data should be talking. It has to be a live feedback. And the need for IT has to step in so that the entire mechanism from where treatment flows in, continuum of care happens, and the quality of life is remaining so, is maintained or is even made better, is essential. So IT needs to be there, and what it really needs to do is predict, help decide, and support. When you talk about help deciding, I look up the internet and I say, okay, should I go to this particular provider who is close to me, or this particular provider? So having, will the smart city, such options really help me? That is something that we should look into. Having said that, recently the government had opened up the RFP for smart cities, which did not have smart cities. Healthcare as an essential component. This is very vital, and just being a part of HIMSS for advocacy, we did point out to the government saying healthcare, a very essential component, had been skipped. And this is also the part where we have to look into legislations and improvement for policies. Thank you.
Thank you so much, Kripa. There's something more which I think I'll just add to what she's saying. I think we need to come up with some kind of management which is made in India. You know, it's only India where we talk about yoga, we talk about homeopathy, we talk about allopathy, we also talk about Reiki and different ways of, curing a patient. So can we come up with some kind of a post-op treatment which is a combination of all these, healing methodologies which actually can be, used for the patient. So that's possibly will make our smart cities a little different from smart cities abroad, and possibly we'll be able to create some different kind of an example here in India. Thanks. Request Mr. Rao from HP to talk about his thoughts on smart city, and he's going to talk about EHR and what all we talked about in the previous session as to how do we combine the dots together of different IT products to make sure that we are able to get what we need in a smart city. Thank you.
Thanks, Dr. Pahuja. Good afternoon, everybody. This is a very interesting topic. And in a healthcare summit, we are talking about smart cities. Obviously, there is a connect. And as actually both the speakers actually elucidated before me and all through the morning, you can't really talk about smart cities or anything if you don't have healthy citizens. And I would like to actually, over the next few minutes, talk to you about some of the interesting aspects of how there is resonance between an aspiration for a smart city and how it's important to have healthy citizens. We live in a world which is actually powered by what is called as an idea economy. Now, don't really get the wrong notion that an idea economy is actually all about economy, and I'm actually going to talk about finances and stuff like that. We live in a world today where technology is actually, confluencing. There is actually a tremendous amount of synergies that are actually possible because you talk about digital everything, everywhere, every day, and everyone is connected. Every business is actually a potential business, and it's actually had sweeping effect on all the verticals that you can think about. You talk about retail, you talk about hospitality, you talk about any segment, manufacturing or whatever. It's actually not really left it untouched, and the same is the case with healthcare. Today, it's possible for us to actually talk about healthcare reaching the masses and great quality healthcare being available to everybody thanks to IT. And IT is enabling this major motion in a big way. And as I said, it's disrupting every industry. The role of ICT typically is actually been to contain costs. When I say ICT, I'm talking about information and communication technologies. Irrespective of what vertical we are talking about, IT came up as a support staff which actually enabled connectivity and so on. And typically it was being seen as a cost center. But you just have to really look at, not really long ago, but then you look at actually what's happening in the world today. The entire retail sector has got disrupted in a major way. And then now IT is becoming actually an enabler for creating outcomes. And those outcomes are what we are talking about over here. Even in the case of healthcare, we are talking about outcomes, serious outcomes that actually touch upon every single aspect of citizens' lives. We talk about how a healthy city can actually enable a smart city, and I would like to actually get into the next slide talking about this. But just let's actually take a little peek into some of the statistics pertaining to India. These metrics are actually from the Ministry of Urban Development. We are talking about 40% of India will actually live in cities, and the population is growing, and also actually the city sizes, and that's exactly why the vision for having 100 smart cities is really, really very good. You have 80% of 2030's urban India still needs to be built. While this covers all aspects, health actually remains foremost. Kripa was talking about how health is actually not something that is a key aspect of smart cities, but I would say that the government is looking at healthcare seriously as one aspect of smart cities. We've actually spoken about it, and there is a very, very concerted interest in actually making that possible today. 60% of India's population will be middle class, demanding faster and transparent services and world-class infrastructure. 24% of population living in slums. This is something that we need to actually think about. Here we are not talking about technology enabling people who already have access to great healthcare. It isn't actually about enabling great healthcare through technology for middle class and upper middle class people. Anything that we are doing, and if it has to be a smart city, you have to take into cognizance the urban poor, the population that actually remains not really mainstream but marginalized. We need to find some way of mainstreaming the marginalized. Anything that we do, keeping them aside, is not going to really make our cities or nations smart. And at the kind of effort that is needed is that India needs to build one Chicago every year to realize the urban vision. That's actually the complexity that's there, and health comes for most of this. So at HP, we've got something called the citizen-centric approach, and what exactly do we talk about over here? Lest you think that here is actually a doodle that came in accidentally, that's a doodle that is from Dr. Chandrakant Patel. He's actually our chief engineer. He's got this unique way of problem solving. It's called design thinking. When we went and when we were actually brainstorming for what should be HP's vision for a smart city, he actually put up all of the stakeholders on a single sheet of paper, and it's typical of any IT vendors, and I'm not really pointing out any one single IT vendor. Typically, what IT vendors do is to actually follow an inside-out approach. I've got a portfolio, I've got those servers and storage and stuff like that, and therefore I force fit it into a requirement that is actually there. This has been actually, typically how it's been followed, across all IT vendors. But then in the case of smart cities, we felt that we'll actually take an outside-in approach, which is we put a citizen at the center of it and really look at an outcome-based approach for what a citizen wants today. And what emerged from those series of marathon brainstorming sessions within HP was something that is actually encapsulated over here. We talk about a citizen's fundamental requirements in terms of, being in a safe city. Very important. I don't want to actually, talk more about it. We all know what the importance of actually living in a safe city. We need healthy people. Very important. We need skilled people. Education, livelihood, all of these things are very, very important for actually creating smart cities. We need to have livable places. We talked about Dr. Pahuja talked about an important thing. She talked about how we can really create those corridors where in the case of actually urgent need for healthcare, you can create actually a corridor where from point A to point B you can reach in actually next to no time. Now that shouldn't be an exception. That shouldn't actually be something that gets mentioned in the news just because it's an exception. We need that happening very frequently. Livable Places talks about actually how we can make our cities provide a healthy work-life balance, and finally enterprising places. I'll just take a minute of enterprising places because it's an important aspect of every smart city. What exactly do we mean by enterprising places? Every city has actually got a DNA of its own. You just have to look at any city in the country today or anywhere in the world, there's a unique characteristic of that particular city. It could be historical, it could be because it enables knowledge, it could be actually any of the reasons, it could be a capital from actually time immemorial. Whatever are the reasons, there is some unique DNA or a characteristic of the city. If a city's characteristic is not there, then probably we'll actually go down the path of some of the other nations that have actually created cities out of nowhere, and they became ghost cities because no one went there. Cities actually, got a life of its own, and that DNA is important. How can a city actually enable its citizens to provide and be a smart city by way of enterprising places? What I mean over here is a city can enable a new age economy, for instance. Think about it. If we are now able to actually pinpoint exact geographical location, and therefore, if you are able to provide services, depending upon the profile that we are, then it becomes very, very easy. To give you a simple example, the civic body or the city or the urban local body creates a master catalog of all the services provided by all the vendors in the city, and wherever you are, you get a set of services that will actually be proffered to the user. Now, enterprising places is something that actually, can be done and done very well by the government, simply because there is a lot of trust in any initiative that's actually driven by the government. So we are saying that these are 5 integral aspects to actually every smart city. And now I'd like to focus upon actually the health part of a smart city. So the vision for the future cities actually, which you saw over here, it talks about these 3 things. My apologies for actually in the font getting all over the place because it's changed the laptop. It solves the problems of urban poor. I mentioned this. It's an important aspect. It rides the mobility momentum. It's very, very important to actually have mobile. Our Honorable Prime Minister in various forums actually talks about how mobile has actually been the most empowering single device that has actually touched every single citizen in the country. And we need to look at how we can leverage that medium and create a sense of empowerment across the board, including healthcare. And how do we improve the government to citizen connect? And if we were to actually look a little deeper in this, we are talking about technology as a catalyst for solving the urban poor problem. You're looking at 17% of global 15 to 34-year-olds by 2020, they will be in India. This is an aspirational population. They want everything. They also actually are demanding and asking for their rights and privileges. How do we actually ensure that happens? Digital India and Smart Cities, which is the Government of India initiative, is also actually driving this entire smart cities, which includes healthcare as an integral aspect. So some of the things that actually, which we have done from our perspective is actually about healthcare. We talk about education, learning to livelihood kind of solution, e-governance. We talk about crime and criminal tracking network. These are safe city aspects. We talk about actually things like the APDRP, which is actually smart grids and power management, and e-procurement, which is actually a transparent way for the government to actually purchase from vendors. These are actually a sample set of, some of the initiatives that we have driven in India. And I would like to, each of these areas actually, will take a long time for me to explain, but I would like to actually pick up one single aspect and, show you a movie now. I'll request Lawrence to actually play this little movie of how an India innovation which covered all aspects that we've actually spoken since morning. The movie, please.
India is a huge country. We have about 800 million people of the population that have little or almost no access to healthcare. Folks need to walk sometimes for days in order to get access to medicine or to healthcare.
এখানে আমার একটা জন্মগ্রহণ এখানে ছোটবেলা আমার একবার পা কেটে গিয়েছিল অনেকখানি ভীষণ রক্ত বেরোচ্ছিল কিন্তু এখানে আশেপাশে ডাক্তার নেই ভীষণ কান্না করছিল কী হবে তারপরে সে আমাদের হসপিটাল সে অনেক দূরে সে চাকদা এখান থেকে স্টেশন থেকে যেতে আমাদের এটা হেঁটে যেতে 15 মিনিট লাগে তারপর স্টেশনে কখন ট্রেন আসবে ট্রেনে করে যাব তারপর আবার ট্রেন থেকে নেমে হসপিটালে যেতে আবার হেঁটে যেতে আবার 15 মিনিট লাগে আমি ভীষণ অসুস্থ হয়ে পড়েছিলাম
Together with partners, we provide access to healthcare services through cloud computing-enabled e-health centers located in the communities where people live. E-health centers can be set up in existing clinics or buildings, or they can even be deployed in a shipping container if no facilities are already available in the community. These e-health centers are fully equipped with key medical diagnostic equipment, an electronic medical record system, healthcare dashboard, and video conferencing features, which are all fully integrated by HP. E-health centers are staffed by skilled nurses or health workers who can perform diagnostic tests while the results are available in real time to doctors far away. We connect doctors in cities to the patients in the community. Technology makes access to healthcare possible anywhere in the world.
আমাদের বাড়িতে অনেক দূরে, কিন্তু বাচ্চা অসুস্থ হলে ডাক্তার বাড়িতে অসুবিধা হতো, এটা হওয়ার পরে এখানে বাচ্চা নিয়ে আসি, হট করে মানে তাড়াতাড়ি নিয়ে আসা হয়।
All of our programs are built on solid partnerships, like with NH hospitals.
Most of the centers are going to tap the entire network, get people in smaller towns and villages to get diagnosed with the right ailments, and then they're referred to the right centers like NH hospitals, where they can be treated further.
We launched the first e-health center in December of 2012, and we continue to expand the number of centers in India as well as in other countries. As of mid-2014, more than 35,000 patients have been registered in the e-health centers. Enabling access to better healthcare through innovative use of technology is a way to advance human progress. This is the way we do business at HP. We bring our innovation and our people together with other leaders to tackle social and environmental problems that affect millions of people.
গ্রামের সুবিধা আছে, কিন্তু অন্যান্য গ্রামেরও খুব আরও অসুবিধা আছে। আরও অন্যান্য গ্রামে যদি এই আশেপাশে গ্রামে যে যারা ওখানে যদি একটা মেডিকেলটা থাকে, তাহলে আমাদের মানুষরা তাহলে সুস্থ থাকবে।
This was done in India, and we are going global with this. And we are touching human lives faster than we can make videos. 35,000 is what Gabby talked about. We are 100,000 plus now, 44 centers across the country, and we are now actually connected with multiple hospitals. Narayana Hospitals actually is one of our partners. We got about 7 or 8 partners right now who are actually partnering us on this initiative. This is India innovation. This was actually designed and deployed in India with our Living Progress team in HP India. So here if you look at, we've got cloud, we've got mobility, we've got Internet of Things. We have those devices that actually talk directly to the cloud. Think about it. Someone in remote Chausala, which is actually about 7 hours away from here, would actually be probably experiencing better healthcare in terms of electronic health record and stuff like that. So much so that this person, who could be just a migrant laborer, when he comes into East, maybe Calcutta or in Bangalore, he or she would actually access their records without having to carry a single sheet of paper. Everything that's aspirational is something that you see over here. Now, this is something that we've actually done. Think about it this way. This will actually form the fulcrum of some of the initiatives which you'll see on the next slide. The promise of technology in enhancing lives is basically about analytics. In the interest of time, I'm not walking you into the production cloud, but sitting here, I can know across the 44 centers in the country how many people have come in since morning, how many people we've actually treated, and so on. If there's an epidemic outbreak, in a matter of few hours, I'll know that there is an epidemic outbreak. And all of those variables that we've actually provided will actually tell us, what's happening with the immobile population. People who are very old, who cannot travel, we know we have a track of them. We got a magic eye that's actually monitoring how they're, experiencing or what they're feeling and so on. That'll help a rapid response program. And then, of course, we actually are talking about, wearables is a big, big subject in healthcare. You'll hear speaker after speaker talking about it today, so much so that, and why so? 2/3 of wearables are actually designed for healthcare, both preventive as well as monitoring. And that's exactly why there's so much of interest. Dr. Pahuja, I would believe that this is an immense opportunity for actually, some of the Indian startups to focus upon and come up with some great solutions. And finally, 3D printing. Very exciting area, still in its infancy. Ironically, I was on the flight today, this morning, and this article is actually from today, this morning's Times of India. It talks about a PIO, a person of Indian origin teen, who 3D prints a $260 prosthetic arm. Think about it. In fact, actually using sensors and voice commands, you are able to actually, he says spoon, and then, the fingers actually, make to actually show that as if it's gripping a spoon. This is from the Times of India this morning. I actually, took the picture on the flight, Bluetooth transferred it into my laptop, and I'm showing it to you now. You can go back and check that out in the Times of India today.
Okay.
3D printing has got tremendous potential.
We need to close, please.
Yep. This is done, and I would like to actually just say that, Digital India can be possible only by healthy citizens, and we can together create a smart nation. Ladies and gentlemen, thank you very much. I'm here for any questions after this. Thank you.
Thank you so much. So we do have examples of something which is actually made in India, which is being used in India, and specifically for our kind of environment. So thank you so much. This is very nice. And you also saw some examples of 3D printing. Believe me, there is a lot of scope for innovation in 3D area, and for people who are in the medical field or in the technology field, I think that's one area. If we combine brains from both these areas, we can actually do a lot. We heard about Jaipur Foot, a couple of years back, and that's something which is talked about globally. But with 3D, we could actually create a lot of factories of Jaipur Foot across in India itself and globally. Thank you. So we've got, after this, we've got Kishore, who's going to talk about a lot of things as to how do we make smart cities livable, more livable for everyone.
Good afternoon. At the beginning, let me give a disclaimer. I'm not from the medical field, so I do not know much about it. So if there is some misrepresentation of some facts or some terms, please excuse me for that. They were just collected over the last few nights only. But I'm basically an electronic design engineer and have been practicing electronic system solutions